you hear me? Oh, cool. Hi, my name is Natasha. I'm a senior caseworker at the Bristol Sanctuary. My role is to triage the calls for the service and to manage the shifts.
So I'm Tammie Hemmett. I'm the team manager for the Safe Haven. So the Safe Haven is based in Weston-super-Mare and it's a crisis and recovery service.
So my name's Marina O'Brien and I manage the Hope Project, and I've been here since 2018 when we launched. So my role is to support the senior and the staff team and have oversight over the day-to-day operational delivery, as well as working with sort of system-wide partners and being involved with the suicide prevention strategies in the differing local authorities.
We're compassionate, we empathise. We don't try to fix people's problems. We're there to listen and support and guide clients at their own pace. I think that's what sets us aside.
We tend to get referrals from the ambulance service and other emergency services, and sometimes the hospital isn't a great base for them. So by coming to us, we're able to ground them, make a plan for that evening or for the next day until they are able to get the correct support in place.
And I love the fact that we're saving lives and that we are providing timely, appropriate support when it's needed to clients. And we're a really unique service because if we get a self-referral, that guy's getting a call back usually the same day, always the next day. You do not get that in any other service anywhere.
The impact I see having on the clients' lives from my work is to ensure that the service runs safely and that there are safe processes in place, and that also we build relationships with other partner organisations in order to support people's recovery.
Some of our clients are very grateful for the work that we do. A lot of our clients do not have family and do not have friends that they can go to, so we do end up being that type of support network. Sometimes just a friendly chat, a listening ear can have an impact on someone's life.
If they share that they're experiencing suicidal thoughts or they share that they've attempted suicide, we will ask for details. If somebody isn't sort of very forthcoming with the detail, we will always ask very explicitly if they're having thoughts of suicide, and if so, ask details about that. Now, that is often the first time that somebody has spoken about feeling suicidal.
It's really important to fund services like the Sanctuary because we are supporting the A&E departments. The impact that we have will reduce the caseloads at the A&E departments and for other mental health services. So it's really important that we continue to get funding for that service.
Why is it important to fund services like Safe Haven? So I think because mental health services have long waiting lists, and if a client is experiencing a mental health crisis, whatever that crisis may be, they require support there and then. So the thing for Safe Haven is we have a 24-hour referral pathway. So if we have a referral come in with a 24-hour response is required, we're able to respond in that time frame. So we don't keep clients waiting.
It would be financially unviable to not fund us, because then you are going to see clients that come to us and get the hope that they need, or the help that they need rather, and the hope that they need. They will start attending their GP surgeries frequently without services like ours. They will start attending A&A repeatedly. And we did some work at an event we arranged some time back, and I got some details from the BRI and Southmead, and the cost that it is for somebody to just set foot in and be seen by somebody, and then assessed by psychiatric liaison, and then if they're an inpatient after a suicide attempt, and it's so very expensive. So we are actually a really cheap opportunity to reduce the demand on secondary services and primary services, whilst also saving lives.
The future for the sanctuary, I would like the sanctuary to have its own building. The challenges we face at the moment is that we are based on the hospital grounds. Sometimes that's quite triggering for our clients. It is very clinical, and it would just be nice if we did have our own building where we were able to support and maybe offer more things. We'd be able to offer group work, you know, we'd be able to offer lots more things.
The future for Safe Haven, if we get recommissioned, will look like we will always adapt the service. I will always adapt the service to ensure we are meeting people's needs. If things change, I will always try and look at a route or a different pathway to be able to suit to meet anybody's needs as best as I can, really.
What I do know is that we've been running an excellent service since 2018, and that we are working with the most at-risk group in society in respect of suicide.
I think I'd just like to say a little something about Second Step. So, you know, I've been with Second Step for 4.5 years now, and I've worked in health and social care for around 22 years, and I have never worked for an organisation who have such meaningful values.
That's lovely, thank you so much.
Thank you.
Yeah, thanks so much for your time.
That's all right, no worries.
Oh my God, I can't believe I've done it. I tend to waffle, you see.
That's good, that's really good.
Oh, thank you.